Welcome and good afternoon. This is Laura Maloof Miller, Program Manager at HealthNet. As you know, Kristen Kayla is also on the line. I'm just going to review a couple of the slides here to start off with. Just a few housekeeping items. Everybody has been muted upon entry to avoid any of the background noise. Also, at the end of the webinar, there will be an anonymous survey, so your feedback is really appreciated. If you have any questions throughout the webinar, please chat directly to Kristen. And as a reminder, everyone who registered for this presentation will receive a link to the recording in just a few days. So today's topic is get to the heart of it, emotions and heart health. So we are pleased to have Christina Viola with us today. She's going to be discussing matters of the heart and what it means for the health of our heart, including the connection between emotions, grief, and heart health. So Christina, on the next slide, just please keep in mind the information provided in this presentation is intended solely for the general information of the audience. It's not medical advice and shall not replace consultation with your physician or other qualified health provider. If you have any health-related questions or problems, please seek the advice of your physician or other qualified health provider. So, Christina, we are welcome. Go ahead and you can switch over to your presentation. I'll cover that one at the end.
Okay, wonderful. Can you confirm that you can now see a Learning by Sharecare screen?
No, not yet. We're still on the HealthNet slides.
All right, that is why I ask these things. Let me get here. All right, how about now?
Yes, now we can see it. Thank you so much.
Wonderful. Well, thank you all so much for having me. My name is Christina Viola. I'm a registered dietitian and a health promotion specialist at Sharecare. And I am so excited to be here with you today to share this webinar. It is one of my favorite webinars within our Sharecare Learning series because it's unique in that it spans across physical health, social health, and emotional well-being. And I think right now with February and Valentine's and Heart Health Month, it's interesting because this webinar talks about how our health and our minds and our bodies and our souls are interconnected. And so for those of you who have not had the opportunity to participate in one of our Sharecare webinars, I want to first just let you know kind of the experience of the day and what we'll be doing together during our time. This webinar experience includes both video content, and interactive activities. And most important, it's a group discussion for us to come together in community. We encourage you to use the chat feature during the discussion session. However, if you're not comfortable sharing, this is a little bit of more of an emotional topic. And so certainly just feel free to journal on your own or take the time to just kind of hold space with the content. But if you are somebody who is willing to share, others tend to learn a lot from hearing from their community. So we hope that you'll be willing to participate in some way. So I'm going to get started with the first section of our webinar here is going to be content that we'll hear from some experts around emotional well-being. And so the agenda today is we're going to go over what broken heart syndrome is. We're going to talk about loneliness and your heart health. We're going to talk about food and your emotions, which I know is one that a lot of people love to chat about. Talk about food and your heart. And then we'll wrap up the webinar today with just key takeaways for our discussion. So let's get started.
Let's talk about our hearts, specifically broken heart syndrome. I always find that it's a topic that people are fascinated with because, you know, the title of the article is always, can you really die of a broken heart, right? And people want to know.
It is when someone is overwhelmed, usually by something not good. It's this huge outpouring of adrenaline. and it's a stun gun to the heart. And it looks like a heart attack. It looks and it acts like a heart attack. But the enzyme levels don't go up very much. If you do angios on these people, they're relatively normal. And it just takes time for the heart to get back to normal.
Sometimes there's this like just severe depression and almost like you stop, you don't have the will to live. You don't have the will to go on. There's nothing driving you, that the pain is so intense that your body just sort of shuts down. I have seen a few people where this has happened, and it's been spouses in my personal experience. Spouses who have been together for a very long time. One of them passed, and the other one just, really didn't have a lot of purpose. And so finding that purpose sometimes can be really helpful. Just finding a new purpose, finding something else, another desire. And this is where I highly recommend the village come in. Where's the family? Where are the friends? Come together, do dinner, do something that's going to just create that community and that connection. And it's difficult when that person doesn't have that village and that support around them. And so then that might mean going outside, going out to community resources, finding something, trying to give them some sort of connection so that they have that new will. And life changes, but it can continue to go on. And then of course we have all of our mindfulness activities. And I think this could go for both the good and the bad. Calming that nervous system, doing some deep breathing activities, meditation, things to just help your body relax a little bit and lower those adrenaline levels.
Okay, so we heard from Dr. Jen Claude, who's a board certified family physician, and Dr. Robin Miller, who's a generalist and integrative medicine expert. And then lastly, Dr. Simpson, who's a doctor of psychology. And all of them, we're discussing this topic of broken heart syndrome and this concept of, can you really die from a broken heart? And so broken heart syndrome is just a temporary heart condition that is brought on by stressful situations. And they gave examples of spouses. I think, oftentimes you hear about, oh, my grandmother passed, and then, my grandfather passed 3 or 4 days later. Those are kind of common examples that we hear when people talk about broken heart syndrome. And I was actually this week on the Today Show, there actually was a feature around broken heart syndrome, and that they're actually creating these excursions and these camps that people can go to that have unfortunately found themselves in this situation of having broken heart syndrome and the temporary condition, where they immerse the participants on these kind of getaway excursions in all of the areas that we heard these experts talk about. They surround them with a sense of community. They put them into physical activity to try to get them to get that serotonin back and moving and getting, happiness from kind of like brain activation. They do things like meditation and journaling there. So I thought that was super interesting that was on, the Today Show this week, and we had this presentation today. And they talk about how, people with broken heart syndrome can experience deep depression because the pain is so intense. It often feels like, your body is shut down. And it comes, in this, hopefully a temporary way. And so I pulled just a couple of tips. Hopefully none of you on the line have had to experience broken heart syndrome or know somebody who has, but if you have, maybe you would also share in the chat with us if you've ever experienced this or know somebody who has experienced this. And while you all are sharing with each other, I wanted to just kind of talk about this concept of, the tips that they had shared. So the first one was finding a new purpose. So that can seem super daunting and struggling while you're going through something so emotional, but they did suggest that for those that are struggling, helping them find a way to experience newness, whether it's through family and friends, and creating like a village of support is, a benefit for those that potentially are struggling with broken heart condition. And if that support isn't available, trying to find community within even social connections. So oftentimes people are pretty hard on social media, but the one thing that is good is it's just a click away from being able to connect into a support group or find communities of like-minded people that might be going through something like you. So even seeing a piece of content that resonates, or coming to a webinar like today and being able to hear from others that have potentially gone through this does help individuals in terms of this, and getting through it. And then lastly, they said to try to practice mindfulness to calm the nerves and help the body relax. So I'm going to pop into the chat to see if anybody has been able to share, and if you would be, open to me reading these out. I see a couple, and I'm so sorry, one, initially to say that anybody who has the courage to share this experience, first, thank you. You're going to help so many people here, but also, sending my condolences. So I apologize that, folks that, have lost a husband, several of you, and that you were there to know that, you had to have support to go through it. And so we're so sorry to hear that. And we appreciate you all sharing. The loss is obviously, something that's just unimaginable for a lot of people and for you all. So thank you so much for sharing, because as you guys share in the chat, others will see that they're not alone and that this is something that others individuals have to deal with. So that was our emotional well-being section. And now we're going to next explore how loneliness may increase cardiovascular risk. And so this segment of the video is not narrated. And so you're going to actually read text while the video is going on. And it'll be illustrated. And then I want you to kind of just read it and take it in. And then we're going to come back and have a discussion about it. So again, thank you for those who are sharing in the chat about your broken heart syndrome. Keep doing that. Keep sharing during the video and interacting with each other. This is a group discussion. And I'm going to just keep the video. We're going to move into loneliness. But thank you so much for sharing it. It helps so many people. Okay, and so while that video stated that there's more research that's still being needed on this loneliness and the connection to our heart, I did think that we could, I do think we all can agree that we're all social beings, especially those gathered here today to kind of be in this social setting and learn together. And so as I kind of absorb those screens, I thought of, as I prepared for this today, a quote from Dalai Lama that states, "We come together in the world as a result of others' actions, and we survive here in dependence on each other. Whether we like it or not, there's hardly a moment in our lives where we do not benefit from others' activities." And I love that because in my mind, it's just underscoring that we not only survive because of having social interactions with each other, and that's why social is one of the 5 Sharecare well-being domains. When you go in and you're doing your RealH test and you're participating in the app, you'll learn, there's 5 pillars that we measure our health: social, community, financial, purpose, and physical health. And social is one of them for this very reason. We thrive both being independent beings and then a collective. And so I thought that that was a really good segment of this presentation. And so on the screen, you'll see a few discussion questions that I'd love to hear from you guys about. And so I'm going to pull up the chat as we get into this section and ask these questions out. And if, folks can, of course, share if they'd like. But do you believe that there has been a shift in connection since the pandemic? And a panelist, an individual said, yeah, I don't think there has been a big shift. I think people can stay connected by being just good humans, learn social and emotional awareness, how to speak to people with respect and communicate boundaries, being genuine and kind. And I think that that's a great way to look at the world. Another said, yes, people are more isolated, especially neighbors. People don't talk to each other in line. And then another individual said, yes, there seems to be heightened social anxiety. And I do feel like it's a mix, and it really depends on the person. I feel like it has gotten a little bit better in years past, but there are people that have had more heightened social anxiety at big events. That seems to have come from the pandemic. I also have found that the work from home changed a lot of people in terms of how much time they spend with other people. Another individual said, I believe people are more used to the distance and it depends on each individual situation. I agree. Another said, I noticed it with my grandsons who were in high school. I do definitely think that unfortunately the kids that were in high school and graduating during this time have had probably the most impact from it in terms of like the time and that social connection changed. But let's think on the positive. How do you guys stay connected with other people? So do you do things like a regular Sunday call with your friends and family? Is there somebody that you do a morning text to help make sure that you're checking in on them every single day? Would love to hear from you guys on how you're staying connected or some new ways to help people get more connected. So it looks like there's an individual who goes on walks and talks to friends over the phone. Church is a great one. Introducing themselves to neighbors. That's a good one when you're bringing your garbage can out, saying hello to people you normally wouldn't. A group chat. Everybody loves to be in the group chat and see the messages come in. I love seeing a family Zoom, salsa dancing, finding excuse to a local cause, to volunteer with is amazing. And being out there and be in the community. I think an individual had asked me to repeat the pillars, and community is one of them. So I'll do that quickly. Social is one of the pillars, and social is having, love in your life, friends that you're connected to. Financial, having the money to be able to do the things you need in your life, the money to support your daily needs, impacts your well-being. Physical, being in good health is one of the domains. I said social, community, purpose is having joy in the work that you do every day. And then what should I fix? Social, community, physical, financial, and why am I missing one? Social, community, physical, financial. I can't think of the last one. Oh, it'll come to me. Okay, folks are sending Friday messages. Purpose, yes. I think I'm just double counting. Emotion is purpose, social, community, physical, and financial. There you go. Virtual Bible study to connect with a book club. Okay, so you guys keep dropping these in the chat because you're giving a lot of people great ideas. And I love that you're sending cards, sending memes. Those things mean a lot to people, especially those people that unfortunately may not have family nearby, that they've created like kind of more of a digital community. Making sure that we're touching in with individuals, it means a lot, especially those who might be going through something. So just doing that touch base to help you and your neighbors combat social isolation. So next we're going to go into, I think just because I'm a dietitian, my favorite part of the webinar, which is around food and our emotions. And so we're going to learn around what emotional eating is, why we do it, because we all do it. How can we recognize if we're eating as a physical or an emotional need? So we're going to get into this segment and I will be back for some really fun discussion. It's coming. It just takes a second.
All I found was that figuring it out gave me even better reasons to explain and justify my fear. So I could stand in front of the refrigerator and explain to you why I was doing this. On some level, you must know that you do eat for emotional reasons. Most of us really eat a lot more than we need to just stoke that engine for a 24-hour period. We're not using food as fuel, we're using it as an object for comfort. Those of us who are overeaters met this themselves. We eat because our team won or because it lost. We eat to celebrate, we eat to mourn. We eat in any heightened awareness state. We were usually taught that quite young, from infancy to early childhood, that any distress, something oral, something by mouth will fix it. So the only way to really know if you are or aren't getting emotional is to initially get put on some kind of a food plan where you know you are eating just the amount you need to stoke the engine. And any cravings or seeking out or hunting out food other than those times will probably be emotional eating. So many people say, well, why am I eating? What are my emotions I'm eating over? What I like to say to people is, if you want to find out why you're eating, don't eat. It's when you stop eating that you will find out what your food's about. When you don't eat at that time, and you instead sit down and start writing your feelings, it will all be revealed to you. A magic happens when no pen touches you. The answers will come, and I hope that you do what your body needs, not what you're saying.
Okay, well, more to chat on together. So I'm going to pull the chat out for this. I think that this section is something we all can relate to. We all have experiences with this, but it's important that we kind of drill down into ways that we can help identify if we're emotionally eating and then what we could potentially do about it. I'm sorry if some folks are experiencing some audio. I'll try to make it louder during the next section. But what she was basically alluding to, and we'll go over it here on the screen, is that we're programmed in our infancy to kind of have like this mouth to hand subconscious soothing of how we all kind of handle emotions, some more than others. And so it can be a trigger that causes us to emotionally eat, but it's really that kind of neuroscience in our brain that allows us to kind of want to find ourselves soothed by food. I think an example that I always kind of use when I'm talking about emotional eating, it can be good or bad. When I was a little girl, I'm Italian by heritage. We show love through food. And so because of that, when I was a little girl, if I did something great, won a tennis match, because I used to play tennis, my family would get me a little cake. So now in my adulthood, even when something great happens to me, I immediately reach for a sweet or something to treat myself. And that's not because of anything other than my subconscious brain showing that that connection to sweets feels like love. And so I'd love if any of you want to share. It looks like folks in the chat said, I like sweets, so I'll buy high quality dark chocolate and allow myself to have a square a day. That satisfies my sweet craving. That is a good tip. Dark chocolate is very high in antioxidants, so a good choice to have. And if anybody else wants to share a food that brings up emotion, definitely feel free to share. I'm going to keep chatting on some of the content here, and I'll get back to the thread as you guys share, but here's ways to kind of identify if you're emotionally eating. It's important to take a breath before you eat and realize or try to connect with your body to determine if you're eating because you're bored, you're happy, you're sad, or you're anxious. It can be helpful to try to have a food journal with you if you're really struggling this. Some people use their notes app or carry a small little notebook. Because again, you don't want it to consume your life, but it is something you're trying to identify if it's a need of yours to determine if this is something that's become a part of your life. You can certainly you can certainly use a journal. Okay, I'll read them out. So far, one of the individuals said, yes, food is tied to my emotions. Another said, I was never an emotional eater. I wouldn't eat if I was happy or sad, but now, oops, it scooched up. But now have become an emotional eater. I'm so sorry to hear that you're going through a breast cancer diagnosis. We're sending you our, strength for your recovery and your healing. Another individual said, I've noticed that when I don't have sugar for a couple days, I become negative and depressed. So I make sure I have just enough chocolate to prevent a dive in my mood. It might be interesting to try to do some journaling there to determine if that's tied to something you can work through, or just have yourself a little bit of chocolate. Never hurts a little bit. Calorie counting in an app has really helped me be mindful. You've lost 10 pounds. Congratulations. I like Greek yogurt with fruit and granola when I feel like I need a treat. That's a beautiful, healthy snack. It includes chia seeds and flaxseed. Very, very good. Great fiber in there. I realized when I was off for surgery that sometimes being at my desk at work was triggering me for a snack. I ate a lot less when I was off. That might be something where you try to take a walk. If you notice that you just had a snack and you're craving another one, maybe go for a walk. And I'm trying to read these out as much as I can. I eat emotionally, sad, mad. Now I try to eat at least healthy, but still emotional. And so I think that as we're going through and, talking through this, keeping a food plan to avoid mindful eating was a suggestion. Keeping a journal of your emotions is obviously another great way to do this. My first technique, and you'll be able to kind of tie when you're doing the journaling, that feeling to what you're feeling, and then to potentially what you crave. And you can even map them together and then try to replace, if you are reaching for something that potentially doesn't have as much nutritional value, if you can swap that in to something a little bit more nutritious, like a piece of fruit or vegetables, is something that you could potentially start to do, as well as replace the eating with something like calling a friend or going for a walk. So for those of you who have shared in the chat, thank you so much for sharing. I'm going to now move into the next section of the webinar, which again has some facts. This is again you're going to read this section as it plays facts, so less audio here, and you'll be able to read the dialogue here, and then we'll jump back in for a quick discussion. Okay, so in that section, you were able to read the text that was scrolling through. I think the two facts that I think are always, important to underscore is that 18 million people die from cardiovascular disease a year, and that someone in the US dies every 36 seconds from heart disease, which can seem very hard to believe. And so while these numbers are extreme, it's likely that you or somebody that you know is impacted by heart disease. And it is, there are genetic issues, genetic disposition to this, but also there are some ways that you can prevent and treat. And so start by ensuring that you're getting your annual physical and checking your health metrics like your weight, your cholesterol, your blood pressure, and then speaking to your doctor about your risk. You can also try to do some things like avoiding things that we know might increase your risk. Research has found that limiting tobacco use, limiting sugar, limiting alcohol, increasing your exercise and your sleep, and of course, monitoring your diet are all ways that can help you as you look to try to combat heart disease. So on the screen, you'll see a few heart healthy shopping list items that you can screenshot or just write down. Again, if you have a nut allergy or anything like that, a fish allergy, please don't go buy it because it was on this list. Of course, monitor and personalize this based off of what you can eat. But these are healthy foods that contain healthy fats that help with your HDL. And so again, always trying to read, the food labels, don't drink a bathtub of olive oil every single day, and make sure that you're kind of keeping all of your macronutrients, how much fat, fiber, protein, and carbohydrate that you are eating within the recommendations of your doctor. Okay, so the next kind of section here as we wrap up, I'm just going to share some key takeaways from today that I thought I would recap for everybody. And so we covered a lot across emotional well-being, physical well-being. And so some key takeaways from our different segments is that broken heart syndrome is caused by a stressful situation, but it is temporary. And so if you or a loved one has gone through this, our hearts go out to you. Look for help, reach out to your community. Don't be afraid to say you need help and support. Social isolation and loneliness can wreak havoc on your health. So stay connected. Make sure that you are reaching out to people in your network they might need to be connected to. Journaling can help identify if you're emotionally eating or fulfilling a physical need. So we talked about keeping, a little journal in your phone app, or you can get a small little notebook you can put. But again, in just a couple of days, if you are trying to identify if you're an emotional eater, you'll be able to identify some patterns. And then lastly, incorporating servings of, I think it's like fatty foods, this is supposed to say, but that good fats in your daily diet can help you reduce your risk of cardiovascular disease. So that is the presentation for today. I want to thank all of y'all for being here. I apologize if there was some audio that didn't come across. I am going to share out with the host a handout that can be shared to those that have attended today. And I just want to thank you all for engaging in the chat with me, so I could read them out to the others in the webinar, so that I could share some of your thoughts with each other.
Thank you, Christina. Yeah, if you switch over to the end slides, this is Laura. I'm just going to go over our slides that we do at the end of every webinar.
Yep, I'm going to grab them back. Okay, share. I think I left you off on this one.
Yeah, that's it. So these next slides are programs that help our HealthNet members build and maintain their healthy habits. All of our members can find our wellness programs and other resources when they log into their HealthNet account. And I'll just talk about a few of them. The next one is the health assessment. So ours is called the Real Age Test. And as you know, health assessments are designed to give you a snapshot of your health in several different areas like nutrition, exercise, emotional health, financial well-being. So ours is called the Real Age Test. If you do not have HealthNet as your health plan, just look at your health plan for a similar offering. And the next slide is on coaching. So it's the beginning of a new year. So you may want to work with a health coach to get some support when you're trying to make some lifestyle improvements or just maintaining your good health. But remember, you don't have to do it alone. So the right support can keep you on track and also help to keep you motivated. And our next slide is the Craving to Quit. So this is HealthNet's tobacco cessation program, and it's designed for those who are ready to quit permanently, to permanently break their addiction to tobacco. Also in California, there is the resource kickitcalifornia.org, open to all Californians. It's a free program, and it also helps for Californians to kick smoking, vaping, and smokeless tobacco with proven and science-based strategies. Next is the Eat Right Now. So if you're looking to make some improvements or just to maintain your good eating habits, Eat Right Now might be for you. This is a mindful eating program. We talked about emotional eating, so that is definitely covered in this program. It's really focused in on healthy eating habits rather than dieting. And the next one is on unwinding. Again, we talked about stress management. Life is stressful. This program is actually open to everybody. It's called Unwinding by ShareCare. And there's different tools and videos, different modules, all to help guide you to build resilience and to help decrease any chronic stress. And of course, we offer discounts for our members. So if you're looking for a weight management program, also discounts on chiropractic or acupuncture services, also on hearing aids, which includes the screenings. And our most popular discount is on the Active and Fit. That is our fitness club discount. It's just $28 a month and gets you access to all the gyms in the network with no contract, and you can change gyms as often as you want to. They also have on-demand programming as well. And then don't forget about our health challenges. These are actually open to everyone. Each month, there's a lot of different ongoing challenges. Some are 30 days, some are 90 days on the topics of stress, sleep, and steps. In March, for HealthNet members exclusively, because March is Nutrition Month, we have the Healthy Plate Challenge that'll run all the way through the month of March. And this is a challenge, of course, to try and eat some healthy habits every day, filling your plate half with fruits and vegetables, making sure you're getting that lean protein and those whole grains in. So if you're interested in that challenge, that's will be coming up. And the next one is our next month. So the March webinar, Healthy Meals for Busy Lives. So we're going to take a delicious journey into healthy cooking and meal preparation. I'm going to show you in my kitchen, not a Michelin star chef, but I'm going to show you how to do some healthy cooking, some healthy meals. How do we do it quickly and easy dishes for the busy weeknights? And I'll cover some topics on how to maintain your healthy eating habits while you're on the go. So whether you're a seasoned cook or you're just starting out, you'll have some practical pointers and the recipes to make healthy eating pretty simple, enjoyable, and good. So hope you will join us again next month. And our last slide is just thanking you again for your time today. Just as a reminder, everyone who registered for the webinar today will receive a link to the recording in just a few days, and we'll also include that education materials that Christina had talked about. So again, thank you for joining us, and you may feel free to exit the webinar at this time. Thank you so much, Christina, for your time.
Thank you all. Have a great day.
Right.